Hello, this is Dr. Terry, MD. Happy Monday. Happy Monday. I'm a little late. I was having a few technical difficulties, but I am excited to be kicking off NICU Awareness Week discussing newborn screening. So every day this week, we're going to be discussing some aspect of NICU awareness. So I'm really excited about that. And first topic this week is going to be newborn screening. So thank you guys for taking some time out on your afternoon to join me. You know who I am. I am Dr. Terry, MD. I am your board certified neonatologist and pediatrician, and I specialize in the care of sick premature infants as well as the care of their families, and term infants as well as their families. And I train busy providers how to help families with sick infants navigate difficult conversations so they can make the really tough choices and help them navigate the NICU journey so that they can receive the gift of hope. So that's my mission every day, to empower providers to provide families with the gift of hope and to help families find hope in the midst of very challenging situations. So today we're going to talk about newborn screening, and I'm so excited because if you have a baby or you were a baby, you have had newborn screening. So this is one test or one aspect of the nursery and the NICU that everybody can relate to. So because it really is a baby's first test. So first of all, what is newborn screening? So there are 3 types of newborn screening, and babies will have all 3 of these tests prior to going home. The first one is a blood test. We're going to talk about that first. The second one is a hearing screen test. We'll talk about that next. And then finally, there's a special test to check the heart. So the first test is the blood test. And so a lot of families will refer to that test as the PKU test. So if you guys can think back to when you had your baby and you're spending time with your baby in your room and you're enjoying all this time with your baby, and then your newborn nurse comes by to collect your baby, take a weight, make sure the baby's doing okay, and then your baby comes back and has a Band-Aid on their heel. And you're like, what happened? You know, why does my baby have this Band-Aid on the heel? And they tell you the baby had the blood spot test or the PKU test. And so that really is more than blood drops on a card. It's really one of the most serious tests that we do. And it's really important that every baby has this test. And in the United States, we have had newborn screening tests via the blood spots on the filter paper for over 50 years. And so different states use different, look for different tests. We all look for the same core tests. Some states look for more tests than others, but all states do the initial newborn screening blood test that some families call the PKU test. So why do they call it the PKU test? The reason a lot of families call the blood spot test the PKU test is because that's one of the most common genetic disorders that we can test for through this blood spot test, but it's not the only one. So the most common disorders that we can check for from the blood spot test include PKU, which is a disorder where you have trouble breaking down phenylalanine, which is an amino acid. It's really important to know if you have that disorder because you have to be on a special diet, and babies can have some really serious complications if that diagnosis is not made. Other diagnoses that are made from the blood test are sickle cell, another common diagnosis, hypothyroidism, another common diagnosis, as well as galactosemia, which is a problem with the liver breaking down sugar. There are 29 basic metabolic and genetic disorders that these blood spot tests will test for. And then there are some secondary disorders that are more rare that these blood spot tests will test for. So depending on your state, I would encourage everyone to go to the website, go to the CDC website or Baby's First Blood Test. Hey, Dr. Hayward to be, Ebony Hayward, thank you for joining us. Yes. Remember, we all did get to go to the state of Texas to lobby for the newborn screening to add the additional tests in Texas, as well as the heart test. So it's really exciting to see that that's come full circle. So that's what I was going to say. In the state of Texas, we actually screened for 53 tests. So, which is really nice that Texas was able to get the expanded screening. So most states should have the core 29 tests, And then you can have the additional secondary tests. So if you go to the website, Baby's First Blood Test, and look at the map, you will be able to see which tests your baby actually can be tested for in your state. And if there are concerns that your pediatrician has based on those tests, they can do additional tests. So in Texas, though, we test for 53. So again, that very first blood test is not just blood drops on a card that your baby has. It's really to check for very serious blood disorders. So it can be a genetic problem. It can be a problem with the liver. It can be a problem with the thyroid. It can be a problem with the adrenal gland. And all of these problems need to be diagnosed very early because many of these babies require a special diet. And if they don't have a special diet, they can die from an inability to be able to convert their fat to sugar. They can have seizures, lethargy. They can have a lot of vomiting and dehydration. So that first test will be done at least 24 hours, not before, because obviously the baby needs to be eating a little bit so that we can see how they're breaking down these products to see if they are missing valuable enzymes. And then the second test is repeated somewhere around 10 to 14 days when the baby's seeing the pediatrician. So even if the first test is normal, we always repeat it after the baby's been eating and growing a little bit just to make sure that the baby doesn't have any significant problems, okay? So, again, to recap, we're doing newborn screening today, so go ahead and invite your friends or share the broadcast every day this week. We're going to be talking about some aspect of NICU awareness, and I thought it would be really cool today to talk about the first test that every baby has, because if we were all babies once and we all had this test. So in the United States, the newborn screening test was started over 50 years ago. So it's really cool to see where that's come. So the first test is the blood test. That's when your baby's heel is stuck and they get those 5 blood spots. A lot of parents call it the PKU test, but it's not just the PKU test. But it's very important to let us know if this baby has a life-limiting condition that will require a special diet. Okay, so that's the first test, is the blood spot test. The second test that every baby will have before they leave the nursery is the test for the hearing screen. Okay, so all newborn nurseries, all states will do the hearing screen test before the baby goes home, which is really, really important because we used to only do the hearing screen test for babies that we consider to be high risk. But we were missing a lot of babies. So now every baby will have that test before they go home. Thank you guys for joining. Go ahead and share, invite your friends. You guys know who I am. I'm Dr. Terry, MD, and I'm your board-certified neonatologist specializing in the gift of hope for babies and families. So every baby will have the hearing screen test now, and it just involves putting a little tiny speaker in the baby's ear and testing for the hearing depending on what state you are in. There are 3 different types of techniques that can be used. Hey, Dr. McQueen, thank you for joining. How are you? I hope you're being safe. But you did get out of Florida, I think. I think you got out of Florida. Thank you for joining us. And so that second test is the hearing screen test. And families really get a lot of anxiety about this, you guys. So a certain percentage of babies will not pass this test. It doesn't mean that they are deaf. A lot of babies will not pass the test because they have fluid in their ears. They still have vernix in their ears. Vernix is that white stuff that covers the baby when they're born, or the baby is not totally still. Like the baby has to be totally still and sleeping to get a really good hearing screen test. And sometimes they'll pass one ear, but they won't pass the other ear. And then families will be really stressed about that. So what I want to say is, even if they do not pass the first test, it doesn't really mean that the baby has something significantly wrong with their hearing. What it does mean is that we will need to follow that up for a more sophisticated test. But when the baby leaves, you don't know if the reason they have a problem with the test is there a problem here at the ear, you know, just a blockage here, or is there a problem here at the brain, like the signal for the for the sound to actually get to the brain and return that information? Is it a problem there? So it's really important to understand as a parent that if they don't pass the hearing screen, most hospitals will repeat it again before you go home. But if they don't pass again or they refer, sometimes we'll say that we have to refer or was referred, they will get a test outpatient that will be more sophisticated, okay? So just to review, we're discussing newborn screening today as part of NICU Awareness, and I'm really excited about it because if you have a baby or you were a baby, you have had this test. So we all have had these tests, okay? So the first one was the blood spot test. A lot of people call it the PKU test. That's when they stick the baby's heel to get the blood to check for very serious metabolic and genetic disorders. Every state will check for at least 29. Some states will check for more. You need to go to the website for baby's first blood test to see what your state specifically tests for. In Texas, we test for 53. The second newborn screening test is the hearing test. About 2 to 4 babies per 1,000 will suffer from hearing loss. And a very common reason for hearing loss is actually being affected by a virus called CMV, cytomegalovirus. We'll talk about that at another time, but that's a very common virus that many people don't even know they've been exposed to, because if you have a normal immune system and you've been exposed to the CMV virus, you may have thought you only had a cold, but in babies it can affect their hearing. So the last test, you guys, that is done before babies leave the nursery is a test called the pulse ox screening test, and it tests for critical congenital heart disease, or CCHD. So that's a lot of words, critical congenital heart disease. But there are problems that can be associated with the baby's heart that don't show up until the baby's older. So until the baby's over 48 hours old, some of them don't show up till 3 to 5 days of age. And they're associated with the way the blood flows from the heart to the lungs, from the lungs to the heart to the rest of the body, and the way the body processes oxygen. And so we can really do a test by putting a little bulb on the baby's fingers and another one on the baby's toes. I'm sure you guys have seen it. Mommies who've had babies, you probably had a pulse ox on your finger. If you've seen somebody sick, it's the little monitor on the finger that lets us know how well your oxygen is doing. And we put that on babies to make sure that the oxygen level in the hands as well as the feet are at a normal level for them to be able to go home. And we need that level to be in the mid-90s to go home. So when they're first born, it may be in the 80s. But when you go home, it needs to be in the mid-90s. And if it's not, that warrants a special heart screening test to make sure that you don't have one of those really serious heart conditions that doesn't show up until later. Okay? And that Dr. Ebony Hayward, who's a medical student, or I say Dr. to be, was here in Texas when we lobbied Congress to get the additional metabolic screening for Texas, as well as through that cycle where we got approval for the critical congenital heart disease screening that all the states do now. So that's happened just in the last several years that's happened. So that's one of the cool things about pediatrics is when we know better, we do better so that we can care better for families. Okay? So just to recap, this is NICU Awareness Week. Every day I'm going to be just sharing a little bit about some aspect of the NICU. I'm so glad you enjoyed it, Ebony. We're going to talk about some aspect of the NICU. Today was about newborn screening, the test that every baby has had. And if you're an adult that's 50 or less, you had the blood spot test, because that's been around for over 50 years. And we've just expanded the number of things that we can check for, okay? So the first test is that test where they have to take a little blood from your baby's heel. So don't get mad at them. It's a very important test. It tells us very important information. We get that information for the critical diseases. We know within 3 to 5 days if your child has that. And for the less critical diseases, we will know by the time the baby's 7 to 10 days of age. Your doctor will get a copy of that report from your state, and you will get a copy as well, but you usually get it after your doctor. Again, the most common genetic disease, metabolic or genetic diseases we test for are PKU, galactosemia, hypothyroidism, and sickle cell. But we check for a core of 29, and in Texas we actually check for 53, so find out what your state tests for. And for many of those metabolic diseases, the baby has to be on a special diet. And if they aren't, they can have vomiting, they can have seizures, they can have lethargy, and they can die. So this first test is very, very important. It's more than blood drops on a card. The second test we talked about was the hearing. We're going to test for the baby's baseline hearing. About 2 to 4 babies per 1,000 can have their hearing affected, so very important test. But if you don't pass the test in the nursery, remember, it doesn't necessarily mean that there is something wrong with your baby's hearing, but what it does mean is that we need to check again. And then finally, we do the screening for the heart, the pulse ox test for the CCHD. And if the baby has a problem with that test, they will get a more sophisticated test called an echocardiogram, where we'll do an ultrasound of the heart just to make sure that all the parts of the heart are there correctly and working correctly. Okay, so I hope you guys found this helpful. I'm Dr. Terry, MD. I'm your board-certified neonatologist and pediatrician. I specialize in the care of premature babies and their families, as well as term babies and their families. I train providers to help families make difficult choices in difficult situations so that they can have the gift of hope. So how do you navigate that journey and still have the gift of hope? So that's something that I find great joy in, and I'm able to do that through my speaking, my webinars, my books, and my courses. So follow me every day this week, you guys, at 4:30. We're going to talk about some aspect of NICU awareness. And so tomorrow we're going to talk about the most common preemie problems that we see in the neonatal intensive care unit nursery. Okay, and if it's something else you want to hear about before the week is over, go ahead and post it in the comments so that I will know that. So thank you guys for taking a moment to join me. I hope you're having an awesome Monday. And thank you so much to the replay viewers as well. I hope you guys found this helpful. Okay, you guys take care. Bye-bye.